Malaysia's Obesity Time Bomb, a national crisis in the making. The authors, Dr. Margarita Paradaryenko and Avise Heng, are part of the research team at IMIR Research, an independent think tank focused on strategic policy recommendations based on rigorous research. Malaysia has long been labeled the fattest nation in Asia. The share of overweight and obese adults rose from 44.5% in 2011 to 54.4% in 2023, an almost 10% jump in a decade. The 2023 National Health Screening Initiative, NHSI, recorded a similar figure, with 53.5% of Malaysians screened overweight or obese. The crisis is not confined to adults. Chua et al., 2024, found that childhood overweight and obesity doubled over 26 years, while Malaysia now has the second highest child obesity rate in ASEAN, with 7.1% of children under 5 overweight. The 2023 National Health and Morbidity Survey, NHMS, showed that 95.1% of Malaysian adults eat too little fruit and vegetables, while 84% are inactive in sports, leisure, or fitness, patterns reinforced by Malaysia's car-centric culture, where the lack of sidewalks, crossings, and bike lanes discourages walking, cycling, and public transport. Ultra-processed foods and sugar-sweetened beverages, SSBs, have become cheaper, more convenient, and heavily marketed, keeping consumption high despite stagnant incomes and rising living costs. Sugar intake remains dangerously high. Cheng et al., 2025, observed that 53.6% of surveyed Malaysians consume SSBs daily. Among university students, the average daily sugar intake is 12 teaspoons, double the WHO's recommended 6. At the same time, the 2023 BMJ Umbrella Review of more than 8,000 studies found high sugar intake linked to 83 harmful health outcomes, most reliably body weight gain, childhood obesity, coronary heart disease, ectopic fat, and depression. Notably, it empirically derived that SSB intake should be limited to less than 1 serving per week, far below Malaysia's daily habits. Obesity is closely tied to non-communicable diseases, NCDs. Globally, NCDs already account for 75% of non-pandemic related deaths, 73% of them in low and middle-income countries. In Malaysia, the NCD fatality rate reached 19.4% in 2021 and is expected to climb, driven by deaths from diabetes, cancer, and cardiovascular disease. Obesity is not only a public health crisis, but also an economic one. It already consumes 10 to 20% of Malaysia's healthcare budget. Obese individuals may also lose up to 12 productive years through absenteeism, presenteeism, early retirement, or premature death. The total economic burden was estimated at 5.68 cents billion, 1.6% of GDP, in 2019 and is projected to soar to $104.55 billion, 4% of GDP, by 2060. To curb sugar intake, the Malaysian government introduced an SSB tax in 2019 at 40 sen per liter, raised it to 50 sen in 2024, and further to 90 sen per liter in 2025. The Ministry of Health, MOH, also launched the Healthier Choice logo, HCL, in 2019, limiting sugar content in sweetened beverages to less than 5 grams per 100 milliliters. Yet the SSB tax has had limited impact. An unpublished MOH study, 2022, found that at least 242 beverages were reformulated to sit just below taxable thresholds, e.g. 5 grams per 100 milliliters for soft drinks or 7 grams per 100 milliliters for flavored UHT milk-based beverages, keeping price increases at only 2.24% instead of the expected 8.83%. For consumers, these numbers mean little. Most cannot interpret nutrition labels. A simple rule of thumb: take the total carbohydrates and divide by 4 to get teaspoons of sugar. By that measure, a 355 milliliter can of reformulated soft drink still delivers more than 4 teaspoons, while a 500 milliliter flavored milk contains over 7, enough to exceed or nearly max out the WHO's daily limit of 6 teaspoons in 1 serving, all while staying under the tax radar. In a country where diets are already heavy with rice, noodles, and sweetened kopi or teh, Malaysians are surpassing safe sugar levels long before the day is done. This is a public health disaster in slow motion, masked by reformulation and weak labeling. Without clearer education, the mentality that 1 or 2 drinks a day is harmless goes unchallenged. Awareness remains another challenge. Hanipa et al. 2025 found 57% of Malaysians with obesity misclassified themselves as overweight or normal, partly because Malaysia sets obesity at BMI above 27.5 instead of 25, as in the wider Asia Pacific. Worryingly, this higher cutoff not only feeds public misperception, but also means official surveys may be significantly understating Malaysia's true obesity burden. The NHMS 2023 likewise showed widespread underdiagnosis. 2 in 5 adults with diabetes, half with hypercholesterolemia, and nearly 12% with hypertension were unaware of their condition. Such gaps lead to severe complications, including kidney failure, stroke, and heart disease. The same study reported that 48% of obese individuals experienced negative emotions after discussing weight loss with healthcare providers, possibly inhibiting follow-up visits and help-seeking behavior. Yet, only 67% of providers had formal obesity training, underscoring the need for professionalization to ensure quality care. Malaysia is running out of time. If obesity continues unchecked, the nation will face a double blow of collapsing public health and crippling economic losses. Tinkering with isolated policies is no longer enough. Malaysia needs a whole-of-society strategy that hits at every level, from classrooms and clinics to supermarkets and city streets. Obesity education and awareness. Scale up school-based education and nationwide campaigns that make sugar risks tangible, e.g. teaching the carbs 4 equals teaspoons rule. Link with COSPEN to expand community-based screenings and early NCD interventions. Professionalization of healthcare providers. Make obesity training a core part of medical curricula and continuing education. Equip providers to design personalized weight loss plans while mandating sensitivity training to reduce stigma and encourage patient follow-ups. Multidisciplinary care models. Establish integrated clinics that tailor treatment to age, goals, and motivation, combining exercise, diet, psychological support, BMI monitoring, medication, and bariatric surgery where necessary. Prioritize long-term monitoring to sustain lifestyle changes. Tax reform and revenue recycling. Lower the sugar thresholds that trigger taxation, raise the SSB tax rate to at least RM1 per liter, and extend coverage to high-sugar foods. Redirect revenues into nutrition programs such as Rangkangan Makanan Tambahan, RCT, and Super Sarapan. Nudges and incentives for healthy lifestyles. Use clearer labels, reminders, and strategic product placement to shift consumer behavior. Partner with supermarkets and fintech platforms to reward healthy purchases and verified exercise milestones. Digital engagement. Develop a national health app modeled after Singapore's Healthy 365 with challenges, resources, and activity tracking. Reward users for choosing HCL certified products and exercising with redeemable points or e-vouchers. Health-based urban planning. Redesign neighborhoods to prioritize people over cars. Invest in safe sidewalks, bike lanes, and green spaces while ensuring walkable access to public transport. As argued in MIR Research's earlier commentary on road diets and car-centric urban design, shifting focus from moving cars to moving people can cut congestion and pollution while also combating sedentary lifestyles. Malaysia is running out of time. If obesity continues unchecked, the nation will face a double blow of collapsing public health and crippling economic losses, undermining productivity, prosperity, and social stability. Only urgent, coordinated action at both national and individual levels can prevent today's obesity crisis from becoming tomorrow's national disaster.
I wish to make some additional points and clarifications. Firstly, SSBs, sugar-sweetened beverages. I've been to Latvia 3 times, and in Latvia, they ban completely sugar-sweetened beverages, okay? You cannot get syrup cordial, you cannot get orange cordial, you can't get Ribena, you can't get Lucozade. Anything which has sugar that you dilute with water to drink is completely banned in Latvia. And as a consequence, the people I see there are all very slim and healthy looking. In fact, even the young mothers pushing babies in prams in the park look like supermodels, okay? So I just want to register the point that you can legislate your way out of obesity. just by banning SSBs completely instead of pussyfooting around and putting taxes and things like that. The other thing is, in Latvia you do find fruit juices, but these are pressed fruit with no added sugar. So it's banned for them to put added sugar in fruit juice. It has to be just the pure fruit juice. And the whole country drinks it, and it's perfectly fine, and everybody is healthy. So I don't see any reason why Malaysia can't emulate what I consider to be world-class best practice. Now, the other point I want to make is about the cancers being non-communicable. Of course, most cancers are non-communicable, but cervical cancer is an exception. It's caused by an infection of the human papilloma virus, HPV virus. So that's why you need to get, ladies, young girls need to take vaccination for HPV to prevent them from getting cervical cancer. The other point I want to make is about BMI. BMI is a rather, rudimentary metric, okay? It does not take into account percentage body fat. So because of this, the BMI ranges for different countries are different to take account in racial composition of body fat, because body fat is determined, part of it is determined genetically, so different races have, you have to adjust the body fat to take into account whether you're obese or not. So different countries have adjusted their BMI differently. In Singapore, they brought down the obesity level to 27.5, as this article states. In Malaysia, it's still 30, and in most other countries, it's still 30. In most countries, the normal range is 18.5 to 25, but Malaysia, as well as most Asian countries, have brought it down to 23 for the normal range. This is to, again, take account the body fat composition. Now, how this was discovered was very interesting. There were two medical students in Oxford who decided to monitor their BMI for life, okay, after they graduated. One was from India, one was from England. And the one from India, although he had the same BMI as the one in England, his friend in England, he had suffered health conditions that were associated with obesity. So when they found out, did further research, that's when they said they discovered that they have to take into account the body fat percentage, and Asians in general have a higher body fat percentage than Caucasians, and because of that, the recommendation was to lower the normal upper limit from 25 to 23 for most Asian countries, okay? Singapore did one step further. Not only did they do that, they also brought down the obesity level from 30 to 27.5. In Malaysia, it's still 30. Anyway, anything above 23 is bad news, so you should bring it down to below 23. And there's a wide range of 18.5 to 23, because you also have to take account not just your body fat percentage, but also your somatotype, your body build, whether you're an endomorph, you're a mesomorph, or you're an ectomorph. Okay, so anyway, all this don't have to get too complicated. If you want to know more, you can attend my workshop on Friday, 5th of September, 2025. It'll be from 2:30 until 4 o'clock. It'll be a high tea in Bandar Utama. And the food that they serve at the high tea is a buffet. There's enough plant-based, whole food, plant-based foods there for me to run the workshop. Of course, there'll be some animal-based foods there, which I would encourage you to avoid. But if you can't tahan, there's actually a rule that you need to be on the diet 99% of the time. It doesn't have to be 100%. So that 1% is for you to lepas again, it's a safety valve. Otherwise, you'll be driving up the wall, climbing up the walls, and then you give up altogether, which is a lot worse. So we have a 1% safety valve there. So if you cannot tahan, 1% means 1 in every 100 meals you can eat meat. So roughly 1 meal every 3 months or so. Now I only eat plant-based, animal-based foods twice a year, on my children's birthday, which is February 4th, and my birthday, which is February 5th. So my birthday is the day of my workshop, so I may eat some animal-based products depending on my mood. Last time I used to look forward to these days where I eat animal-based products. Now I can take it or leave it. I don't feel the necessity because I'm so used to eating whole food, plant-based foods since 18th of October 2018. So this year it would be 7 years since I've been eating whole food, plant-based. Now, it's also important to not just know what to eat. In fact, to know what to eat, I've adopted a very simple system called the traffic light system. So we categorize foods under 3 colors. The red light foods, red light category are foods that you need to avoid at all costs, or if you have to take only 1% of the time. Yellow light category are the ones which have high nutrients, but also high calories. So you need to avoid eating, unlimited quantities. So there's a quota for this. For red light foods, they are high calorie dense, and usually high calorie density foods are also low in nutrients. Okay, they have low nutrient density and low nutrient diversity. Now the third category, which I will show you at the buffet, you can eat it and you can remember because you're eating it, are the green light category foods. The green lights you can go ahead and eat until satiation, unlimited quantities until you feel dah kenyang, you cannot eat anymore. So I'll tell you what they are at the workshop. So those are the 3 simple categories for the traffic light system of eating. Now, not only what you eat is important, when you eat is important too. So there is a new emerging science called chronobiology, and it informs us that you should eat before dark, before nightfall. So when it's important, don't eat after dark, only eat during daylight hours. The reason is quite long and complicated. Just if you want, you can ask me on Friday. It's to do with work done by a Nobel Prize winner, Michael Rosbash of, I think, Boston University, as well as Professor Sachidananda Panda of the Salk Institute in California. Okay. And the other thing is, when you have your meals, when you eat, the sequence that you eat your meal is also important. Okay. So I will teach you on Friday when you eat the buffet, you should eat by courses, the way the Mat Salleh, Chinese or Japanese eat. They eat course by course, rather than Malaysia, we have all the lau and then we simply gas out whatever we like all together. And the consequences of not eating in sequence would be you can have very stinky flatus, or you can have diarrhea or constipation. I made videos about this. I'll put the link so that you can see for yourself all the evidence to support these claims. Now, I have to give you a caveat. I'm not a nutritionist. I'm not a medical doctor. I'm just a patient. Like every one of us are patients. Even doctors are patients, okay? Don't forget that. And I decided to use what I learned when I did my doctoral research, which is actually in management, to manage my own personal health. And one of the things I decided a long time ago is not to take what my MO tells me. The medical officer is a